Hey y'all, hey. It's been a while since I picked up my camera. I actually haven't picked up my camera since the first week of rotations, and we finished week 2 on Friday, so we start week 3 on Monday. So I'm just gonna kind of give a little sit down and talk about my experience this far, only because it's really hard to record in the hospital. I honestly haven't pulled my camera out not one time in there, unless it's like to take pictures. Ignore my background over there. So yeah, hold on, let me turn the low light off. So we're starting week 3 on Monday. So far I could tell y'all what I've gotten to see. I've gotten to see a ventral hernia repair, a gastric bypass, a skin graft, a AV fistula, go in for a patient that has dialysis. I've seen pressure ulcers, motor vehicle accidents, drug use, people who get super blacked out drunk. I've seen a lot of stuff. Periodontal cysts, I think I'm saying that wrong. Periodontal cyst, abscess, stuff like that. So basically the way it works is within our surgery rotation, there's 4 different rotations within the surgery rotation. So you have SciFax, which is colorectal and minimally invasive. Then you have Matori, which is trauma and acute care surgery. Then you have LaFaw, which is surgical oncology, plastics, urology, vascular, and thoracic. And then you have your surgical ICU. My first one was SciFax, which is colorectal and minimally invasive. So that one was cool. I scrubbed in on my first case on my second day, and I got to close. That's probably the most hands-on thing that I've done since I've been in surgery. Since I've been on this rotation, was scrubbing in for that and closing the wounds, y'all. Suturing on a wound that is bleeding, and then you also have another person on the other side suturing too. They don't talk about how hard that is, and I'm pretty good at suturing on that little fake skin thing. So now I'm currently on Matori. Other than that, I've just been going in the OR and just watching the surgeries whenever I am able to, or whenever they allow me to. Most of the time they do allow you to watch. So my second one that I'm in right now is trauma and acute care surgery, which is Matori. So I've helped fix a wound vac, reseal a wound vac. I've seen them dress a few wounds. I've seen pressure ulcers. We have clinic days on top of going in. And the clinic days is basically when you go in clinic and you actually see patients. So I went into clinic, when was that? Tuesday. And I believe I saw 5 patients. I basically went in there, got a history and physical, figure out what they came in for. Then I would go tell the resident as well as the attending. And then we would go in the room together and do whatever. So that was cool. I got to remove some stitches. So I'm seeing a lot of cool stuff, but at the same time, it's a double-edged sword. I'm seeing a lot of cool stuff, but I'm also a little disappointed in a sense. Only because, y'all, before we started rotations, they didn't tell us, like, oh, there's not really any PAs in the hospital. They didn't tell us that. So basically, there's an attending, and then there's residents, and then there's the interns, which are the first year residents. So they assign each of us to an intern, and we follow them around. But since they're all MD, there's no PAs. They don't really know what to do. I feel like they've been showing us stuff. Don't get me wrong. They've been doing what they can with what they got, showing us how to read CTs and stuff. But since they don't really know about the PA field, they don't really know what to do with us in a sense. So sometimes I feel like we do miss out on a lot of opportunities or cool things that we could be doing simply because we're also on there with medical students. So being that they were previously medical students, they know the medical student modules, whatever they're supposed to be doing. So a lot of opportunities are given to the medical students. Honestly, if they would have told me that there was no PAs before we started the rotation, I don't know, I just probably would have prepared myself for that. It's going to be a lot of times when you sitting around not doing anything, which is cool because I've had time to sit around and study. But at the same time, I wish they would have disclosed that because I could have found some locations where there are PAs, or 2, just prepared myself for that, because most of our rotations, sorry, my dog, most of our rotations are in Howard Hospital. and there's no PAs. The surgeons did tell us of a surgery orthopedic PA that was there. So we went to go find him, and come to find out he'd been there for a while, but he's leaving and he hasn't been in the office in a while. So that sucks, but I am able to see some cool stuff. Oh, there are PAs in the emergency room. There's 3. That's the only place really in the hospital that has PAs. So that's a bummer. But so far, my first 2 weeks have been great. I'm actually about to take my dog to get a groom, and then I'm gonna go get my nails and toes done, so I'm gonna bring y'all along with me. I've also been studying. I found this girl who made all these charts for each rotation, so I've been using this, and I've been doing blueprint questions. What else? We, like I told y'all in my orientation video that y'all will have seen by now, because I'm gonna edit at some point this weekend. I just was having issues with CapCut. We have to write a soap note every week. So this is my week 1 soap note. I did it on the gastric bypass that I did. So I did a operative soap note. We have to write them by hand, by the way, which y'all gonna know that from my previous video. And then my current soap note, I'm writing another operative soap note on the ventral hernia that we repaired. So that is what's going on. Sorry, my dog, like, what you doing, girl? That is what's going on right now. I'm about to take her to go to the groomers, and then I'm gonna go to the nail salon. Everything is in walking distance, and both of our appointments are at 9. It's currently 8:41, and both places open at 9. So I'm gonna hurry up, drop her, and then go. But let me know if any questions or anything that y'all want to ask me down in the comments. I'll try to answer. I'm gonna try to record more throughout the week. It's just really hard to record in the hospital, and then we also chill in the residence lounge, so I don't want them to be like, girl, why you recording? Because I'm still a shy content creator, or a shy YouTuber, whatever you want to call me. But yeah, I'm just looking at my lips. Y'all should go get this. I am a Fenty beauty fanatic, and yeah, I got almost every lip gloss that she has come out with in every color. So trust me when I say y'all should get this one. It's cute. But see y'all later.
Andy Prodigal to Louis. She high maintenance when pursuing. That's what I like. That glow, it ain't unreal. She's sexy and red and don't like dealers. Yeah, that's my type.
Good morning, y'all. It is currently Thursday, 6:04 a.m. on February 6th. This is my 3rd week of rotations, but we're approaching the end at this point. I honestly haven't been picking my camera up because it's hard to record what's going on when I'm in the hospital or whatever. And I don't really want to post where I'm at, even though but people be crazy. They might try to find me in the hospital. People are crazy. Anyways, I am currently headed to work. Well, I need to be there by 6:30 every day. It's 6:04. This week I'm on LaFall, so that's urology, plastics, oncology, vascular, all those different types of surgery. So that's cool. I haven't really went in the OR for anything for this since I've been on this team. I have when my friend was on this team. We went and saw a skin graft, so that was cool. But yesterday, I don't know, I'm sorry, I'm talking in circles. So in another clip I recorded, which I think I recorded, I'm gonna include it, of course. You're gonna see it before you get here. I talked about how there's no PAs besides in the ED. We ended up finding a PA in orthopedic surgery. There was one of them, he don't work there no more, and the other one, he still works there. So we went and we spoke to him yesterday. And today he's allowing us to come shadow him, see what he does as an orthopedic surgical PA. So that's gonna be cool because y'all know in general surgery there are no PAs down there. So that's what's on the agenda today. We're gonna see him repair ACL, and he also has another case later for a meniscal tear. So we're gonna go to the ACL one first. That one is at 7:30. He told us to be 7. So I'm currently headed to the hospital. When I get there, we usually have rounds at 6:30. So I'm gonna go to rounds for at least the first few patients, and then I'm gonna go change into my OR scrubs, and then head down to ortho. And so that's what's going on today. What else can I talk to y'all about? What other cool things have I seen? What the heck did I see yesterday? I done seen AV fistula case. There's something that I saw the other day that was really cool, and I was about to suture, but I cannot think. Oh, a gallbladder removal, a cholecystectomy. That was cool, only because, I don't know, the whole laparoscopic idea is just so cool to me. Not the one where they doing it with the robot, where I'm talking about the one where the actual surgeon is using, I don't know the names of the tools, so it's using the tools and the sticks to do everything, but it's like he's not in there, he's just only looking at a camera. So when he did the gallbladder removal, they have to put a plastic bag in there, and then the resident takes the gallbladder, puts it in the plastic bag, and then they pull it out. I think that's so cool. Technology is crazy. The robot probably cool too, but I haven't seen it. I only seen them actually do it. So, but that's all I have to say right now. It's currently raining, and I don't know where the heck my umbrella is. So I'm gonna be really mad if I walk through this from the garage to the hospital and my hair is poofed up, because y'all know I'm back on my leave out. I will say though, my hair does a really good job at staying straight. This week I probably only had to put heat on my hair one time, and that was yesterday. Or if I go to the gym, I do be having to put heat on it. But if I go to the gym, how you put the stuff on and just let it dry. If I take it off and it don't look too poofy, I don't be caring. I'm not straightening it, because I don't want my hair to burn off. But I've only put heat on my hair one time this weekend. It's Thursday. Oh, so tomorrow the school is closed, and the med students are not gonna be there tomorrow. So we thought we was not gonna be, like, we was gonna have us a day off. So we emailed our clinical coordinator, and she said no, we have to go. So we're all kind of sad about that, just because y'all, the burnout is low-key real. We be tired as heck. I know some of us been so tired that we have barely even had time to study when we got home from school, because you just want to go to bed. And we honestly thought that clinicals was gonna be, I don't know, you less burnt out, but it seemed like we still just as burnt out. I will say though, I've been doing a really good job with studying while I'm at the hospital. If I'm not doing nothing regarding the patients, I'm studying. So that has helped a lot, but I still feel like it's not enough to get me at least a 75 on the EOR. Only because a lot of the topics that we're covering for the exam, we don't actually see it. So a lot of times you remember what you see much easier, because it's like, I did this, so I can. But we don't be seeing some of the stuff that's on the surgery EOR, and some of the stuff from the surgery stuff is very new to us, because our surgery class, I don't know, some of the stuff, I don't know. I think for the surgery class we should have started with the basics. She more so focused on, I don't know, I don't even know what, I don't know. But honestly, anything that I did in the surgery class, I have not been able to apply it to actual surgery rotation, aside from the pre-op and post-op. But even some of that stuff was, trying to think what else I have been able to, the suturing, that's it. I haven't really been able to apply anything else to the surgery stuff. But I have talked now for 7 minutes, so I'm gonna keep my camera in my pocket today, and I'm gonna do what I can. But I be scared to record in the hospital these days. People are crazy. They might find me and report me for something I ain't even do. So I don't know. But all right, bye. Unfortunately, this is the last week of my surgery rotation, and y'all, I'm gonna be real. I haven't recorded, and the reason why I haven't recorded is we be so tired that one, I forget. It just, I don't know. And it's hard to record when you like going in the OR and stuff. So I'm basically gonna have to do like a sit down of all the stuff that I have done since being on this rotation. I've done a lot, so I don't remember everything, so I'm gonna write it down. But y'all, I'm gonna try to record. I'm gonna try to vlog this last week, especially because I'm in the SICU, so it's not like, you know, I won't really be in the OR unless I want to go in there. So yeah, I just got here. I'm about to park. My camera is actually on 5%, so I'm about to go inside, charge it, and then let's get this show on the road, because I have not been on my Zoom. And then the rest of the rotations, I'm gonna be on my Zoom. But talk to y'all in a minute. Right now I'm studying. I was doing some stuff, looking at my patient stuff, but done with that.
Gucci Louis. She high maintenance when pursuing, that's what I like. That glow, it ain't unreal. She's sexy and red and don't like dealers, yeah, that's my type. Beautiful woman.
I got called a disappointment 3 times, basically.
But she's been doing good. She's not disappointed.
She's lying.
She has the residents. Anyways, I haven't picked my camera up since this morning. We're currently eating our lunch,
She just said good morning.
which is cool. This is Mari sitting over there, running her mouth. Irby and me. And yeah. So what have I done today?
The funny thing is,
I reported 2 patients.
Let me tell you, I gave
and
Moni
I
a whole
studied.
layout of how to present. She goes,
My presentation was
she has
horrible.
hypotension.
And I didn't mean to say hypo. I swear on my
know,
paper
I
it
looked-
says
I looked at the window and
hypertension.
I was like, what did I write down?
No, my presentation was horrible. But it's because once they said, okay, we got there, and he said that the attending had already came that morning. So we weren't presenting. So I'm like, okay, why would we do rounds if it's just you? So I'm like, okay. He told me to get the patient, so I'm like, write it down, only the pertinent stuff. And then when I'm presenting, it's almost like everybody was waiting for me to say more.
Yeah, because when you finish, he's like, okay, so neuro-wise.
Yeah, so then he starts doing the presentation. I'm like, oh my God, I forgot all about that. It's been a day, guys.
Today I sutured, and then they ripped my suture.
All they had to do was glue it back together, so that's really fucked up. Okay, bye guys. So y'all, we finished lunch, and now we just in the bathroom getting stuff out of our teeth. Nasty. Look at how old this bathroom look. I know y'all see it in the back room. Oh yeah, I said I was gonna let you smell me.
Just give me the bottle.
Okay, whatever you want.
I don't like it. I'm going to take a picture.
It smells really good. It's like a good everyday scent. Victor and Ralph Flower Bomb. Okay, guys?
Okay.
I should probably go check the PTC before I go sit in that lounge.
Why? He's going to get lunch now.
I know, but if I'm sitting there doing nothing, I know he's going to be like, did you get it? Did you get it? So I'm going to just go check it. And then come.
Should we just go with you?
If y'all want, I'll be quick, I hope. I found my earring, by the way. It was in the car, but the post part that you stick in your ear is gone. It broke.
Well, that's good.
Life is worth living.
It is not.
Okay. This is our locker room. That we don't have a locker in. This is the machine we get our scrubs. And now I'm going to go check the PTT on my patient. So we have to write a SOAP note. Turn it in every Monday by 8 a.m. So I'm currently writing one using fake information, like as far as like name and stuff. So yeah, I'm waiting to go home. Did it snow last night? Oh my God, it's so icy on the road. Good morning, y'all. How is everyone? It is Tuesday. It's my last day of my rotation. I'm actually kind of sad. How do I say goodbye to what we had? The good times that made us laugh outweigh something bad. I thought we get to see forever, but forever's gone away. It's so hard to say goodbye to yesterday. I'm actually kind of sad, y'all. I'm a little bit sad. Not 100% sad, just a little. I wish I had one more week, mainly to study. Of course, for my rotation too, but mainly to study because our exam is tomorrow. And everybody from my group is nervous. I'm going to tell you why we're nervous. So, normally for our exams, our program makes the questions. And it's not that they don't do a good job making the questions. It's just the questions are not comparable to like the PAEA question. Well, we don't know what the PAE questions are. But the, the blueprint and the EOR questions, it's not super off, but those questions are freaking hard. It's so hard. I did a practice test for the exam. Practices, they had a surgery EOR practice exam that we split the cost. My little group, girl, I got a 37. I can't be having that. So I'm nervous. Now the EOR questions, those questions are good. I like EOR, I do. But the blueprint questions, you really have to pay attention to the small details. But yesterday, my one of the residents, he sat down next to me and was walking me through the way he takes exams. So I'm going to use his advice and take my exams that way because it actually helps versus you just reading the questionnaire and picking an answer. No. But it's 6:52. I don't have to be there till 7:30. Before, like I told you, I used to have to be there at 6:30. But today, and I would still be going early. Yesterday, I actually got there at 6:45. But girl, today I was tired. Me and my group, we met up last night. And I stayed there till 11:15-ish. And then when I got home, we got on FaceTime. And we talked through some topics to make sure we know what it is, what it ain't. And now, here I am, headed to school. I thought it was going to snow tomorrow and Thursday. I'm like, ooh, I hope it snows so then our exam can get pushed back. But it's not going to snow. But it is. You can tell it is something last night because it's like a white sheet on the road. But I have now talked for 4 minutes. Being that it's my last day, we're going to do our best to vlog without getting people information there. Because where I sit at, that's why it's hard to vlog. Where I sit at, I'm at a workstation in the SICU. So it's stuff everywhere, like, and people can see me. But I'll see y'all when I get to work. Hey y'all, I didn't vlog when I was at work. It's currently 4:37. I know y'all wondering, girl, why is you still not home? I know I said I was leaving at 12 or 1, but I indeed did not leave at 12 or 1. I didn't leave that at that time because I wanted to go by and tell my preceptor like thank you and stuff, and like, okay, you know, like today's our last day, you know, the professional stuff. And I was told that she was gonna call me around when they get released for lunchtime because he was in a meeting. But when she called me, we was doing rounds and the attending at the time was speaking to me and asking questions. So I had to miss the call, and then he couldn't see me after that until like 3:15. So I went. But yeah, I just thought that was important, like to like at least say thank you, because I mean the preceptor, and then I told y'all it's residents that we work with, so we see the preceptor like in the OR and stuff, but not all the time. So he don't know our schedule. He don't know like, oh, this day last day. Oh, he don't know the new people coming in. Cool. So, oh wow, who knew that this was right here? So yeah, I'm headed home. I was able to study at least while I was there. I did get to see some a cool thing. I got to see a chest tube insertion for somebody who has pleural effusion. So that they was doing a thoracocentesis using a pigtail. So that was pretty cool. It was bedside. I never seen that before. And then I got to see him take blood from, hold on, I got to look something up. I got to see him take sorry, they texted me telling me to bring snacks, but everybody ain't their mama know I don't buy snacks. I don't buy that. I literally don't buy snacks, y'all. But they took y'all, the whole road is closed down. That's what's taking me so long to get home. But we did a blood drive from the femoral vein. I never seen that before. I also never drawn blood before. I did ask him if I could do it, but this was not a good patient for me to do it on for my first time. So he was like, well, that's exactly what he said. He said he don't think this is a good patient to do it on for my first time. Cool. So yeah, now I am headed home. I'm actually gonna go change my clothes real quick, maybe take a quick little shower, then I'm going to study. But it's literally gonna take me forever to get home because the whole entire road is closed down for whatever reason. So I'm trying to find a different way to go home. So it's gonna take me 20 minutes. We can see, I can go this way. But yeah, all right, I'll see y'all when I get to my study session. I'm not sure where she want me to get snacks from, but girl, I don't have snacks in my house. Excuse me. And everybody and their mama should know that, because I really don't. I don't own not nan snack. Not nan. Got water. I don't even got no packs of noodles. But all right, bye y'all. Good morning, guys. Okay. I don't remember if I even picked my camera up yesterday, but I know I did the day before. I'm currently headed to school. Yesterday we took our EOR exam. It's always something, is all I'm gonna say. It's always something. So we didn't get our scores back yet. We're supposed to get them on Friday. I'm gonna pray that I passed, and the reason why I'm gonna pray is my entire group studied the wrong my entire group studied the wrong topic list. There's basically two versions of the surgery EOR. There's a new version that they just created in September of 2024, and then there's like the old one, and the topic lists unfortunately are significantly different. And we did speak to our program about it and basically told them like, oh, we were under the impression that we were taking the 2025 one, and we did not take that one. But because I guess the topic list is at the bottom of the syllabus, they said that we should have read the syllabus. So we're gonna pray that none of us have to retake it. I'm feeling confident, but at the same time I'm not feeling confident, only because it was quite a few things on there that like we just did not study. So hopefully I remembered it from when I learned it during didactic. But if I do have to take it, oh well, life goes on. But yeah, I'm currently headed to school. It's 8:23. Today we have to present one of our self notes that we did. We have lunch, and then I think we have like a guest speaker for pediatrics, or it might be the same professor that taught us pediatrics. I guess she's coming in to show us how to do a pediatrics exam. Other than that, I'm going to the airport today because I have drill this weekend. So I don't know if I'm gonna stop the vlog before I go to drill or if I'm gonna keep it going. I gotta see how much footage I have so far. But yeah, I'll see y'all when I get to school. I like the song Give Me a Hug by Drake on his new album. I really like that song. That's the best song on the album, period. So we're about to do a pediatrics exam. This is our baby. Her name's Simone. It looks like a he a little bit.
Oh.
But if you wanted to be a girl, she can be a girl.
You also said that the Bates videos were down. They're back up, so just review those because it's one of the OSCE-driven skills that you need for competencies. So I want to be able to check you off. We won't do it for rotation 2, but probably rotation 3, where it's kind of we're doing. So you're going to do the exam with them. This was just more, I was talking to them about what we're doing for when they start to do the checklist. They're just going to do the checklist.
I said, how do I look you up?
So So each person should physically demonstrate.
What's a
Dr.
given?
Porter has a few moments after.
Mature their lungs, or may have, depending upon how early they were born, then you would have a different type of physical exam, such as tone, etc. So I'm gonna, nice little sweater. We're gonna take the clothes off the baby.
Take the
Okay.
clothes off.
Okay. They come in with cute outfits. Okay.
Put your laptop
They match. Okay. Okay. So you're gonna.
It's cold.
So that's fine. Then you look at the forehead. And forehead, not a whole lot happens, unless it's frontal bossing, but you don't even see that. That would be rickets, etc. But the forehead should be pretty symmetrical. The nasal, you're looking at the baby, the nasal bridge is fine. Now the eyes, you wanna look, you wanna make sure that you have your reflex, your pupil reflex. Okay, you're looking, make sure it's equal. That all for changes. Okay.
She's so rough.
Not feeding you a whole lot of garlic and onions, but feeding you, massage your feet. All of that, you gotta do that, okay? But you wanna address postpartum depression. And
Take the clothes off.
By
Talk
the way,
to him.
sometimes
Talk
you'll
to
get-
him.
Talk to the
Your eyes
baby.
are
Yeah.
Listen, what he need to hear from me?
Just talk.
I'm just talking to get
Oh.
these clothes on.
Oh gosh. Oh, he rough. He said I was rough. He is rough, y'all.
Alright, first we're gonna do just observe for any distress. Let's see any
Hi, little baby. Are you distressed?
What they gonna say? Yes. What you gonna do?
Victor, talk to the baby.
Symmetry. The baby is symmetrical. I think they're. The suck reflex. The startle reflex. How are you gonna measure the startle reflex? You just.
We just said that.
Startle. Ah. Ooh.
Y'all listen to starter reflex.
Mm-hmm. Drop them a little bit. Shake them up a little bit.